A new study shows that 7% of adolescents polled have reported problematic social media use characterized by addiction-like symptoms. The report, which studied over 200,000 teens in Europe and Canada, also found that adolescents from lower-income families experienced poorer health and well-being. Here's CGTN's Wilkis Tanyabwa.
Mornings are for serious business for one family in Kenya. With schools across the country closed owing to the COVID-19 pandemic, lessons are conducted through video conferences. But afternoons in this house in Kiambu County are for exercise, laughter and good wholesome fun. It is time that Elizabeth Moiruri cherishes as it gives her an opportunity to catch up with her children.
This is the time we are understanding them, we are learning them, and we are bonding very well. We become very good friends.
But not all families get to enjoy these simple joys together, and a recent study has shown that adolescents are feeling the impact of a changing way of life.
The Health Behavior in School-Age Children report provides valuable insights to parents to help them identify areas of concern among adolescents, the key changes that have taken place in recent years, and strategies that they can employ to help these adolescents develop into well-rounded individuals.
For over 30 years, the Health Behavior in School-Age Children report, a World Health Organization collaborative study, has provided data about the health and behavior of 11, 13 and 15-year-olds. The 2017-2018 survey report presents data from over 220,000 young people in 45 countries and regions in Europe and Canada. Researchers found that just 19% of adolescents achieve the global recommendation of 60 minutes of exercise every day. 1 in 5 adolescents were also found to be overweight or obese. But it was online communication which has many worried. 7% of adolescents reported problematic social media use, which is characterized by addiction-like symptoms. While the study did not extend to Africa, Elizabeth is well aware of the challenges that teens face in a digital era.
What I always tell my teen, there are those social media platforms that are very destructive. Even they can clog your mind with so much. So it's always necessary to prioritize with the necessary things.
At her house, gadgets are left downstairs at 9 p.m. when the children go to bed.
I'm able to get some rest, and for tomorrow, since I'm studying, I'll have better concentration.
This approach is reinforced by Dr. Boniface Chitai, who says parental guidance and support is vital in ensuring the mental well-being and development of adolescents.
These children can be left to be children by simply being given love, being provided for what they need by the parents, and being shielded from responsibilities of adulthood.
Ultimately, the report concludes that while adolescents from lower-income families experience poorer health and well-being, improving the health of adolescents requires action by all, and it begins at home.
It is up to us as parents so that we don't regret in the next 20 years, because whatever we are bringing up now, eventually the outcome will be in the next few years.
Wilkis Tanyabwa, CGTN.